Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by Dr. Kevin Toman. He is a repeat guest, and today we're talking about pet supplements. We're talking about myths around pet supplements your dog might need, things to consider, a very important topic that is near and dear to me. So, Dr. Kevin, thank you for joining us.
Thank you for everything you do, Brittany. I'm happy to be back. I had a great time last time, and hopefully we help your listeners, pet parents, learn a thing or two, and I'm back for more. Let's do it.
So something you said off air last time prompted this, and we were talking about supplements, and I mentioned a study I had read about glucosamine, and essentially at the end of the day, they were like, you know what? It's a waste of time. It's a waste of money. There's way better things to do for joint supplements. So let's talk about some of the most common, maybe most trendy supplements. We'll kind of bog through them a little bit. And you can kind of tell us, yay or nay, things to think about. And so I said glucosamine. So let's think joint supplements in that umbrella of like glucosamine, chondroitin, MSM. What are your thoughts on those?
Fair enough. Yeah, well, see, I have to start right off the bat, Brittany, with a mea culpa, with an apology to many of the pet parents that I've worked with over the last 40 years in veterinary practice. Because for about 20 years, I carried glucosamine chondroitin products like Cosequin and Dasequin. And listen, some of that was at the behest. I mean, the folks who make Cosequin and Dasequin, a company called Nutramax, they have a very active outreach program for veterinarians. There's all kinds of dinner opportunities, all kinds of lunch opportunities. And so Cosequin and Dasequin in particular are many millions of dollars to this company. But the unfortunate truth is that when I recommended those products, I was wrong. Now, one thing bears mention, and that is, I hold myself to be a little bit of a scientist, and that may or may not be a popular thing to say in today's political environment. But one of the things that, as a 66-year-old, science has taught me is it evolves. And what we thought we knew at one point, what I think I know now, may change with time. And as a scientist, and especially as a veterinarian, it's my responsibility to the pet patients, the patients I care for and their parents, to evolve with that science. And unfortunately, current science absolutely says that glucosamine and chondroitin products do not work in either humans or pets to reduce joint inflammation.
Yeah, I think I think that's a smart way to go about this, is to say things change, we learn more, science evolves, more studies come out, and so we want our practitioners to evolve with that, right? Like, we don't want our practitioners stuck on what they learned 10, 20, 30, however many years ago, and at the influence of maybe the people who are selling these products, right? Or making these products. And I think we see a lot of that in vet med and in human med. And so since our last conversation, I personally used the rest of the glucosamine supplement because I'd spent enough money on it.
Yeah, absolutely.
And I am not reordering it. So on the other side of that, and hopefully I'm right on this, let's jump into fish oil, because I have been using I think it's a wild Alaskan salmon oil. So, and there's different fish oils, right? From different places, the sourcing, the amount of omega-3s, perhaps the amount of omega-6s, different things. That's kind of been my crutch for joint health, along with other things, right? I mean, it's great for brain health, heart health. It's good for like their coat and their skin. So let's talk about fish oil. So do you think I have a leg to stand on to say that fish oil is good for joint health, or
Yes,
do
you
you
do.
think I'm blacking?
No, you're in good shape. You're in good shape.
Okay.
And so let's get off. If you and I were to go to the nearest Costco, you and I could literally walk down virtually a whole aisle that is given over to glucosamine and chondroitin products. And
Hmm.
unfortunately, sadly, we ought to just burn them all. We ought to just mow them down. But there are four different products that are proven to support naturally healthy joints. One of
Mm.
them is fish oil. And in particular, it's the EPA component of that fish oil that does the best job for our joints. And as you suggested, however, not all fish oil is created equal. And the biggest concern is always, well, let me rephrase that. There are two concerns, actually. One is the fact that fish oil spoils over time. And so, in a perfect world, you would buy just enough fish oil, Brittany, to last you 2, 3, at the outside, 4 weeks. But if
Mm.
you have, if you're buying these big old, 500 count supplement bottles, I'm going to tell you that by the time you're a third of the way through, your fish oil is probably doing you as much harm as good because the fish oil, once it becomes rancid, creates inflammation in our system rather than solving it. And unfortunately, you don't know that simply by taste. You don't know that by the appearance or any other component of the appearance of your fish oil. But the other thing that we now see, I kind of lost my train of thought. Um, so the other component of fish oil products is this: their sourcing. Because you're absolutely right. Where fish oil originates from is crucial to us. And here's why. Because if we think back to the food chain, look back at your old high school biology days where we learned how algae are eaten by sardines and sardines are eaten by mackerel and mackerel are eaten by swordfish, etc. The higher up that food chain you go, the more mercury concentration, especially, I mean, there are other heavy metals, but in particular, it's mercury. And
Hmm.
so, small fish have just a little bit of mercury, but when 10 small fish are eaten by a medium-sized fish, all of a sudden that medium-sized fish has 11 times that mercury and so on and so forth. And so by the time you get up to good-sized fish like salmon or the swordfish that I enjoy eating, the reality is that mercury contamination is a very real concern for us. There are areas where lead is also a concern, but primarily it's mercury. And
Hmm.
so there's a couple different ways to minimize the chances of mercury contamination in the salmon or in the fish oil that you're taking. First off, you're absolutely right in thinking about geography. If you have a salmon-based fish oil that comes from Alaska or comes from the North Atlantic, we think these are two areas that have the very least mercury contamination in all the world's oceans. And so I preferentially agree with you. I recommend the use of Nordic Naturals, and you can delete this out if you choose, but there are several Alaskan salmon brands that I recommend, and I recommend Nordic Naturals because it's a Northern Atlantic salmon oil as well.
I have used Nordic Naturals in the past. I switched to a different brand. I'm not going to say the name of it here because I don't know if I'm going to stick with it.
Okay.
And it's interesting that you said that about how long I'm keeping it because I do actually get quite a big, it's a pump bottle that you just do a pump in each bowl. I'm going to say that lasts me about 3 months, which is now kind of flagging for me. I might want to buy in smaller quantities. Now, granted, you save money, when you buy in the bigger quantities. So you're tempted, right? You're tempted to go with that. So that's something to think about.
Yeah, and one of the other ways that you can get away from the mercury issue in particular, and to a large extent the rancidity issue, is by using an algae-based fish oil, quote unquote, an algae-based. Let me rephrase that more appropriately. An algae-based fatty acid supplement rather than your standard fish oils, because they're at the very low end of the food chain, so you don't have to worry at all about mercury or heavy metal contamination. And these are typically available as a dry product, so you get away from some of the rancidity issues. The hard part is that they are several times more expensive than the standard fish oil products that you and I would like. And I speak as
Hmm.
somebody, in full disclosure, I'm kind of working on a couple of supplement formulations myself for eventual sale. And so I'm trying to weigh, Brittany, whether I use an algae-based omega-3 fatty acid or whether I go with the cheaper fish oil. for all the reasons
Mhm.
that we've talked about.
Yeah. And I think that's something that pet parents weigh as well, but I think at the end of the day, if you are buying the cheapest pill on Amazon, I'm thinking it's better to just leave it. Don't even spend that money. If you're buying kind of that bottom of the barrel, that 9.99 sale on Amazon, which with inflation, maybe 19.99, but maybe we just skip it all together, right? Because we're probably doing more harm than good whenever we're doing something like that, right?
Could very well be. You know, you hate to paint with a broad brush, but there's absolutely that possibility. They're
And you
typically, and I
mentioned
hate to phrase it like this, but they're cheap for a reason.
right, right, exactly. And you mentioned, so you said there were 4 supplements that you like for joint health.
Yeah,
So fish
absolutely.
oil, and then what are the other 3?
So let me just bounce back to fish oil and put a button on this by saying that Purina, for instance, has a joint management diet, a prescription diet specifically designed for arthritis. And the only difference between it and a quote standard kibble is the fact that it does have fish oil in there. And there again, you know, in a 40-pound bag, you do have to worry about rancidity issues. But when you look at a prescription quote joint diet, the reality most times is that the only difference is that they have fish oil in there. They may
Mhm,
have some glucosamine and chondroitin in it as well, but I'm going to shoot holes in that all day long. And
mhm,
so now I'll put a bow on that fish oil discussion and say that there are in fact 3 other supplements that any parent of a large breed dog, including certain Belgian Malinois puppies who are 12 weeks old at this point, ought to know about. One is the most important is undenatured type 2 collagen or UC-2. And that's a patented form of collagen. And I want to be very clear about this. There is a lot of bullshit. There's a lot of misinformation around collagen products on the human and veterinary markets right now. Listen,
mhm,
standard collagen products will do a pretty good job of nurturing the what remaining hair I have left. They'll do a decent job of taking care of my skin. But standard collagen products that you and I take as part of a supplement will do nothing, repeat, nothing for our joints. And here's why. Because collagen is denatured by stomach acidity. And so if you're eating a standard collagen product and it passes through the stomach and it's been treated at high temperatures as a rule as part of the processing, then it just simply is not going to do any good at all for your joints. There are benefits for your skin, there are benefits from your hair at lower doses,
mhm,
but for joint products, it just simply doesn't work. So the difference is that this undenatured type 2 collagen or UC2 is actually a patented product. And when they say undenatured, Brittany, all they mean is that instead of being cooked at 400 or 300 or 400 degrees like most collagen products are, this is cooked at or below 110 degrees Fahrenheit, and so it requires a lot longer, cooking process, but that leaves its molecular structure intact, and the reason that that's important for us is that, undenatured type 2 collagen has a molecular structure very similar to joint cartilage in our bodies or in our pet's knees or in our pet's shoulders or in our pet's elbows. Why
mhm,
is this so important? Because now we know, Brittany, that most of the pain, most of the swelling in my arthritical joints is caused not by cartilage rubbing on itself like this, like we always
mhm,
thought, but
right,
rather because that joint cartilage, the little small fragments of joint cartilage from the front that are caused by the abrasion in there, get into our systemic circulation where our immune system says, "Hey, wait a minute. They don't belong to me." So our immune system mounts an allergic reaction or an inflammatory reaction, excuse me. That's more accurate, an inflammatory reaction against our own joints. And undenatured type 2 collagen acts to desensitize our immune system against that. So there are actually studies that show undenatured type 2 collagen, and again, we can abbreviate it just as UC2, is actually more potent in reducing joint inflammation than nonsteroidal pharmaceutical drugs. And that was a study that was done in human knees.
hmm,
In dogs, there was one study that showed up to a 92% reduction in joint pain in dogs without any other therapy other than undenatured type 2 collagen. So, if you're going to prioritize your joint care, your own joint care, Miss Brittany, given everything you have going on, and my own joint care as an old fart, I'm going to prioritize undenatured type 2 collagen right at the top of the list because of the immune modulating, the calming effects that it has for our joints. Number
Mhm.
2 would be the fish oil. Number 3 is our new friend, CBD. Okay.
Mhm.
And I'll talk more about that in just one second. And then number 4 on the hit parade is green lip mussel, which is actually available in a couple different products. But CBD is, there's I live in California, and so you can't go around a block in a commercial district without seeing a convenience store or a gas station or a health food store that is carrying CBD. But
Right.
unfortunately, there was just a study that came out about a year and a half ago where researchers bought 17 different over-the-counter CBD preparations and analyzed them all, and what they found is that how many products actually contain CBD? 3. 3
I
of the
believe that.
17. And
Yeah, it's such
so,
a trendy thing right now,
yep,
you get this hemp oil with so many different cannabinoids, maybe there's CBD in there, you don't know,
yeah, yeah,
and then it just gets pushed forward because there's really no regulation on the marketing of it, right? They can say, "CBD oil helps with joint pain," and people are purchase.
yeah, yeah, and there's so much baloney out there in both human and veterinary marketing. CBD is not a panacea. It does not cure every ill ever known to man. But we think what it does do, Brittany, is this. It does reduce seizure frequency. And so if you have an epileptic dog, or if you're a human epileptic, or God forbid you're dealing with a brain tumor, or whatever the case may be, please consider CBD as a natural part of therapy
Mhm.
along with coconut oil, some of these medium chain triglycerides, et cetera, a subject for a different day. But CBD has been proven to decrease seizure frequency. It's been proven to reduce skin itch if you have an allergic dog, like some 12-month or 12-week-old Belgian Malinois puppies may become. And has also been proven to reduce joint inflammation. So a lot of the other stuff on the market just simply has not been proven. The brand that I recommend, and to be clear, I make no money. I have no association with this company whatsoever. But if you're a pet parent and want to use CBD, my strong advice is to use a company called Elevet, Ellevet, because they do the research. They have the studies to show exactly how much CBD their products contain. They have the studies to show whether this works for a specific health issue or not. And so they are my recommendation for pet parents that are interested in CBD at this point in time.
To your point on CBD helping with seizures, I had a 17-year-old or 16, almost 17-year-old Pom, she passed in October, and she started to have seizures a little bit more frequently. We didn't know why, but she did have a very aggressive mammary cancer. It was spreading along with some other issues, cognitive decline, and we noticed if we could sustain CBD in her system at very high doses, I mean, we were dosing her pretty high, she was having less seizures, and then if she were to get into an episode, we would syringe 2 or 3 whole droppers, and it would almost cut the seizure right then and there, and
Mm,
she wouldn't have
okay.
another one, and
Yeah.
prior to kinda playing with that and figuring that out, her seizure she might have 1 and then another, and so once we figured that out, we were able to kind of I don't wanna say stop them because it's not a magic, it's not like we fixed anything, but we were able to kind of decrease the length of her episodes, the frequency of her episodes. For the most part, I'm not saying overdose your dog in any capacity, but for the most part, I feel like CBD, it's pretty safe, like the endocannabinoid system can handle quite a bit and we all have different loads that we can handle. And so I felt okay giving her a little bit more than what was suggested, so to speak. And I'll put that in quotes because I think everyone can sustain a different level or have a
Mhm.
different capacity for CBD, whether it's a human or a dog. Some people might be susceptible to half a dose, where some people might need 2 to 3 times what's recommended?
Mhm. Yeah, absolutely. And one of the things that I'll mention just as we close out the CBD chapter here is that There was originally great angst around dogs ingesting THC.
Mhm.
In other words, dogs ingesting marijuana as opposed to just CBD, because as most of your pet parents probably know, CBD has really no intoxicating properties whatsoever. It's the THC component of cannabinoids that can get you high, quote unquote.
Right.
And there have been study after study that show that, yeah, I mean, it's not a great idea. Listen, kids, don't go out of your way to smoke marijuana around your dogs or to leave any product laying around. But if they do get into a little bit, day in and day out, it's not any threat to their health. Now they're going to act just like me back in college. I leaned up against the wall for a while or wanted a pizza or whatever the case may be, but there just aren't any fatal toxicities associated with this, and so, listen, use some discretion, the golden retriever puppy that I have is probably much better at tolerating something like that than the Pomeranians that Miss Brittany has, but the
Mhm.
reality is, if it's just a whiff, you guys, don't go spend 3 or $400 of your money at an emergency clinic. Let's take care of your puppy, take care of your pet, excuse me, make sure, you don't let them up on furniture where they're gonna fall. Don't let them near stairs where they're gonna fall. But the reality is most times a rug and some close personal attention will get you through, the average THC problem without any issue whatsoever.
Mhm. Yeah, and let's stay on the topic of CBD for a second because CBD is great for joints as far as joint health. Could be a pun intended there. And then also as a calming supplement. But
Mhm.
calming supplements kind of are on their own bucket. So you've got CBD products, you've got melatonin products, which I've never used. You've got different herbal blends, which some of them I've used with I'm trying to think, maybe like 5-HTP, valerian root, maybe some of that kind of stuff. So what are your thoughts on calming supplements as a bucket?
This is gonna be a short conversation because I just haven't found any that are reliable from one patient to the next. That's the honest truth, and so, b for fireworks and the like, everybody, veterinarians sell the heck out of tranquilizers around July 3rd, for obvious reasons, and maybe
Right.
January 30th. And so traditionally, I would say that I've used a combination of serotonin products, melatonin products, CBD, and actually over-the-counter antihistamines like Benadryl in particular, in an effort to calm these dogs down. And I would tell you categorically that I've probably failed as often as I have succeeded. I'm very much an integrative guy. I've been in integrative therapy and veterinary medicine for probably the last 20 years.
Mhm.
But I will freely admit its shortcomings too. And this is one case where I simply don't have as much knowledge to impart to your pet parents as I would like.
Yeah. I feel like a lot of vets feel that way, right? It's like we can try this, we don't know how it'll work. I know I've had 2 different dogs that we've done trazodone and gabapentin, and while
Yep.
I don't love it, and no one probably likes to prescribe it, that sometimes works under a prescription at the advice of your vet, temporarily used, right?
Yeah, yeah. There's caveats in place, but yeah, if you're asking for the nearest thing we have to a true calming medication that you and I can count on, I would say some combination of trazodone and gabapentin would be your player. In the old days, we used to use a product called promazine, but the problem
Mhm.
is that it dropped blood pressure pretty significantly, and so we're very hesitant, rightfully, to use that in dogs on long distance plane rides, dogs with heart issues, dogs with seizure disorders, etc. And so these days, yeah, I mean, to the best of my knowledge, Brittany, you're absolutely 100% correct. Traditional allopathic veterinary medicine, veterinarians are going to reach for trazodone and or gabapentin, and usually a combination thereof.
Mhm. Yeah, so, yeah, I don't think it hurts to try calming supplements. I think everyone just needs to know it might not work. You might waste your
Yeah.
money, might be trial and error, you know?
Yeah, so the key is, I think that if, for instance, you're angling towards the July 4th, I mean, start trying these things, in
Right, right.
mid-June or whatever, give them a
Yeah.
little trial run. And so I can help your listeners, help your pet parents down the road with dosing on some of these products if they like. But The time to learn whether they're going to work for your pet or not is not the night of. It's a week or 2
Right.
weeks before.
Right. And same with traveling. Don't just travel, get on an airplane for the first time, be like, let's try this because it might not be your best bet. That's how we found out the palm that passed. She had such a high threshold. I'd given her max dose of trazodone, her max dose of gabapentin. It did not touch her. So I'm in the air texting a vet. I'm like, can she have more? He's like, she can have this much more and this much more. I gave that to her. I was like, it didn't do anything. He was like, good luck because you already max dosed her. And she's just sitting there clawing at her bag. And that was my failure. I should have been getting her ready. I should have been practicing putting her in that bag, keeping her in that bag for long durations. I should have tried the trazodone and gabapentin to see, hey, is she going to sleep on this? Is she going to fight it? So just a word to the wise to be
Yeah, I mean,
prepared.
I've played all the games myself. It's just, and every time you think you have dogs figured out, or especially cats figured out, they'll
Yeah.
make a liar out of you every time. So, yeah,
Right.
absolutely.
Yeah. So let's talk about probiotics because probiotics have ebbed and flowed in both humans and animals. And, every now and again, I'll see a hard push for probiotics for dogs, and then I'll see kind of the market back down, and then I'll see another push. So, what are your thoughts on probiotics?
I think generally they're pretty darn good. I mean, if you buy a good probiotic, I think that there's substantive evidence out there. There are a lot of studies that show that you can help to normalize your pet's gut health, but also, Brittany, that quote normal gut health unquote extends to your pet's joints. The inflammation
Right.
travels. I mean,
Right.
that'd be the best way to phrase it. So if my stomach is upset, if my intestines are upset and inflamed, the inflammation that starts within my intestines is going to worsen my joint function. It is
Mm-hmm.
going to worsen my cognitive disease. It would worsen any spinal issues or whatever the case may be. And so there's clear evidence now that maintaining normal healthy gut flora does help to prevent cognitive disease in both humans and pets. It does help to reduce inflammation. It does help to reduce allergic disease. And so, yeah, I kind of, without belaboring the point, I fall on the yes to probiotics side of the equation. In fact, one of the things that I'm doing routinely now at Helping Pets Live Longer, which is the company that I run, I routinely recommend microbiome testing. And you can do this for yourself, for your own pets. You don't need to spend a 10 or 15% extra with a veterinarian like me. The company that I choose to use is Animal Biome, and they have a very well equipped website. And here's what's fascinating, Miss Brittany, is that if my dog Annabelle, who just passed by, if she was running into chronic diarrhea and I sent a poop sample in, and they diagnosed her as being low in a particular organism, they
Mm-hmm.
actually have a series of pre-made capsules that I could give Annabelle to restore her normal gut bacteria to normal levels, which is kind of intriguing to me, back in the
Yeah.
old day, and we can laugh about this, but I have tried fecal oral transplants on some of the dogs in my care. If these dogs had chronic diarrhea but lived in the same house with a dog who had normal poop, I was not above running a tube down these dogs' throats and giving them a little poop, a shot of poop, so to speak, quite literally. But we've refined our technique at this point, and now Animal Biome in particular can not only diagnose any abnormalities in your pet's gut microbiome, but also help you treat them a little bit more palatably.
Well, that's interesting. I might do that for my dogs. So all 4 of my dogs now eat raw. We've been making adjustments. It made it easier. I wasn't going to switch over my 16-year-old, but he just kept getting sick. He kept throwing up his dinner. We were doing like a ground turkey with the fish oil with like a vegetable blend. For some reason, he stopped tolerating it. And I know people have even been on the podcast and they say, do not put your senior dog on a raw diet. There's no reason to change their diet. I changed it. He's been doing great on it. But prior to that, it might have been nice to do some of that testing. But I say this about raw feeding because I actually supplement now with goat's milk. And I know that can be hit or miss with some people. It's been good for us so far, a little bit pricey. And then I use what's called Gussie's Gut. It's a fermented blend of dehydrated vegetables. And so we sprinkle that on everyone's food to get them a little bit of that. It's essentially like a probiotic, it's all
Mhm.
fermented vegetables. So that has been really helpful for us. So I'd be interested though in sending everything out and seeing, are there certain things, certain dogs that I have are low in or deficient in, or are they high in a certain bacteria? So that's helpful to know.
Yeah, I mean, look, and on an evolutionary basis, listen, dogs are pretty tough individuals, even poms. I mean, the reality is that, I mean, they were born to be scavengers. And so, for instance,
Hmm.
dogs don't need tetanus vaccines because their gut is essentially, I mean, they see so much, goofy stuff pass through their gut that they're kind of immune to some of the diseases that would create a big problem for you and me.
Right.
But having said that, every dog is an individual, every cat is an individual, and every human is an individual. And I'll bet, I mean, I know that I can certainly think of 3 or 4 people in my little sphere that are lactose intolerant, and 3 or 4 people in my sphere who, for whatever reason, don't eat beef, but like fish or, I mean, there's just all kinds of different, dietary variability. And so a couple of, points there for your listeners. One is the fact that if you are gonna feed a raw diet, the risk that Brittany alludes to is just that traditionally, and listen, I'm not a big kibbles guy, but I'm gonna use this as an example. Kibbles are run through such a high temperature as part of their processing that any pathogenic bacteria, the E. coli's or salmonellas of the world, are fried to death. But in
Hmm.
raw diets, by definition, traditionally there hasn't been any way to completely rid a raw diet of those bacteria that can create big problems for pets or for that matter for humans. And so there's always been a little bit of a stigma around raw diets for potentially immune suppressed pets or for instance for pets in families where there was a pregnant female because you girls when you get pregnant your immune system goes haywire and sometimes for the better and sometimes for worse. And
Hmm.
so the moral to the story is just that if you are going to feed a raw diet, kids, let's make sure as best you can that you know what your supplier is doing and how that food is transported, where it is stored. There are
Hmm.
processes like high pressure rather than high heat pasteurization that can get you away from some of the bacterial contamination issues. But I would tell you categorically, I've seen 2 dogs in my practice die from raw food.
Mm.
They made a change. One dog died from salmonella, the other from E. coli. And so, you just have to go into this with your eyes wide open. The moral to the
Right.
story being, listen, I mean, I'm not going to stand up here and preach. I think raw diet, actually, to be honest, is a healthier approach than kibble diet, than some of these other maximally processed diets. We spoke about that a little bit in our last conversation.
Hmm.
But, be cautious if you have a dog or a cat that has an immune issue, and above all else, just figure out how much you can trust the manufacturer and the retailer of your raw diets.
Right.
And so, yeah, I mean, I guess that's what I would say. And the other thing, see, yeah, you make a statement and you just can't get me to shut up. When you have dogs or cats that are vomiting soon after their meals, usually or developing diarrhea as a result. Usually, that is a reflection of a subclinical sensitivity, a subclinical allergy to the meats in their diet. Not so much the vegetables, but one of the things that you can do if your particular pet, a dog or a cat, is running into the vomiting right after eating or diarrhea, is simply to change the protein very deliberately. If you're
Hmm.
on a chicken-based diet, change to a fish. If you're on a fish-based diet, change to pork or whatever the case may be. Now, here's the problem, Brittany. Most commercial diets, it's that cross-contamination issue that comes back to bite us in the ass when you and I go to a restaurant, where it's not
Hmm.
so much this meal that may not contain any peanut butter, but I mean, did they cook any peanut butter, in the last half hour in the same in
Right.
the same area? So that's always a concern. But many times, for the pet parents that are listening to you, you can minimize the vomiting, minimize the GI issues that your dog or cat is going through by taking a good hard look at the protein, at the meat source within that diet.
Yeah, that makes sense. I've had some friends that were chicken based and then they went maybe beef or turkey and it alleviated the issues or, vice versa. So I think that that's great and helpful advice. So let's talk about the next supplement. And this is one that I personally don't think any humans need. I don't think any dogs need it. You might disagree, but multivitamins. What do you think about multivitamins?
I think that's fair. I think that multivitamins are overused in both human and veterinary medicine, to be honest with you. And y and, so but full disclosure, I mean, I take, I take AG1 on a daily basis, and do I need AG1? Well, maybe I do because, when my girlfriend isn't here, I live like, the typical 66-year-old white guy, concentrate on meat and carbs probably more than veggies. And so the AG1, for instance, for those of you guys who don't know, it's just a powder that contains a bunch of different fruit and vegetable, ingredients that in theory kind of makes up for the things that I might be missing in my diet. And so that same thought exists in vitamin therapy. Gosh, if my diet is not adequate, maybe I just take a multivitamin and it kind of soothes that itch. It eliminates that deficit. The hard part is that unless you actually go through actual vitamin testing, which is a thing for both humans and pets, we can look very, very deliberately at the vitamin C, the vitamin D, the vitamin E, the vitamin B levels in your system. And almost without fail, vitamin A, B, C and E for that matter are pretty ubiquitous. I mean, very few people, very few pets are deficient in them. Vitamin D
Hmm.
is a little bit of a different story. I mean, these
Yeah.
days, because everybody's spending more time inside scrolling on their laptop than playing in the streets like I used to. The reality is there's a pretty significant concern about vitamin D levels in humans. And the thing to remember about our pets is that they cannot make vitamin D from sunlight like you and I can. They need dietary vitamin D. And so, if you were thinking about one vitamin to supplement your pets with, I suppose I could walk down the vitamin D road with you. But day in and day out, Brittany, I agree. I think multivitamins are probably widely overused by both humans and pets.
Hmm. Yeah, it's not one size fits all, right? And a lot of the multivitamins, the overall production of them, the way that they're compacted into these pills at high heat levels, again, it's like, what are you truly getting from that?
Yeah.
Um, I back in the day was a manager at Vitamin Shop and I wouldn't even push the multivitamins. People would come in, they'd be like, I need a multivitamin. And I'm like, well, did you get labs done? Talk to me. Where are you at with things? Because a lot of vitamins, they work in conjunction with other things. So if for humans, you take a D3, you might take a K2 with it, or certain vitamins, you need a fat supplement or you need vitamin C to absorb it. And we could talk about that forever. But multivitamins probably skip. And if you're worried about your dog's overall health, having that panel and seeing what are they deficient in, how can I adequately supplement that?
Yeah. Yeah, I mean, there are some things, on my third visit, you and I could talk about when lab tests are needed and when they aren't. But, if you have a chronic disease or if you have a pet who just seems to be failing, these are times when tests are absolutely warranted. And so, I mean, if we don't look, you and I will never ever find. And that applies not just to a disease, but also to vitamin or nutritional deficiencies.
Hmm. Let's bump into the next one. Now, this one, kind of a broad category, but skin and coat supplements. And I'm thinking biotin, which I don't know if you see in that many dog supplements, zinc, some omega blends, if you will. How do you feel about skin and coat supplements?
Well, I would say that us humans, with our vanity, are much larger consumers than the average dog, the average cat. And so, I'm not sure. I think this may be another one where your knowledge vastly exceeds mine, because I would tell you that when I think about skin supplements, I really think about them in the context of these pets who've been allergic for some time or running into atopy or some of these other skin diseases where you and I need to look at ways to help improve the skin barrier against allergies, or we need to
Mhm.
moisturize it to help restore some semblance of follicle growth in these dogs or these cats. And so I tend to have a pretty narrow approach to this. And the honest truth, Brittany, is that I would be hard pressed to come up with a clinical rationale for using biotin or zinc or even collagen products in these pets. Now, one thing I will tell you across the board is that if you have a dog or a cat with flea allergies, for instance, and they end up walking around with a big bald spot over their tail. The reality is the more moist you can keep that, even if it's something as simple as aloe vera or neosporin or just Jergens hand lotion, the better the cosmetic result for you. But what has your experience been in terms of biotin and collagen and zinc and some of these other widely used human products for skin?
I don't find that most of them work. I mean,
Yeah.
biotin's just another B vitamin, and for years, they've been pushing biotin as, like, hair, skin, nails, and at the end of the day, it's a water-soluble B vitamin that you take it, maybe you absorb a little bit, maybe not. You pee out the rest, you know? Zinc, I feel like I think of zinc more of like immune system, you know. I know some people use zinc 14 days before their Botox appointment to make their Botox last longer. I don't know if that works. I'm just saying I've heard it.
Okay.
Try it. Everyone try it. I see a lot of skin and coat supplements for dogs though on Pomeranian sites because they want their Pomeranian's hair to be silkier or they want to like manipulate the undercoat, if you will, and I'm just like, "I don't
Yeah.
think I can get behind this because I don't think this works."
Yeah, I mean, POMs are poster children for a bunch of hormonal alopecias, alopecia X or POM. I mean, there are 3 or 4 different POM-specific diseases that I
Yeah.
could call names around, and and to be honest, we don't have great ideas on how to solve that. I mean, melatonin is still on the list. You test these dogs for various hormonal disease like thyroid or Cushing's disease or whatever. And so
Mhm.
you as a palm mom, you are probably vastly more interested in this than the average Labrador retriever or Schnauzer mom, to be honest with you. And again, it's one of these situations where I wish that I mean, if I had a cure all for this, Brittany, I would tell your pet parents first. And then secondly, I'd be making it and selling it, but I don't.
Right.
And so, you know, uh, yeah, that's about all I can say. Interestingly, I was just on the podcast with a a gal who's been in the Irish setter business for about 1,000 years. She's a lawyer and, kind of our Venn diagram bounced off each other like that. And she said, "Oh, yeah, my Irish setters, they always used to get tangled," which is a big concern for me with my little golden retriever, Annabelle, too. She's got big, long
Mhm.
feathers on her tail. And she said, "You know what the best thing is for that? It's Pam, the cooking spray, for your nonstick pans or whatever." She said, "You spray a little bit on the your tail, comb it out, and you're good for 3 weeks. You never have to worry about it again." So that is my skin, tip for the week in response to your question there.
Will say instead of Pam, I like coconut oil. So I weekly or biweekly, and it's been a little less frequently lately because the dog's been rolling in dirt and accumulating it, but I like to put just a little coat of coconut oil on them. They smell good, their hair looks good, their hair is healthy. There might not be any science behind it. I put coconut oil in my hair, the dogs get it, we just go round table, everyone gets it at the house. The younger dogs always get, like, a spoonful every now and again, and they love it, so that's just something that we do.
Yeah, well,
Alright,
good for
let's
you. And speaking of coconut oil, I will tell you, I'm going to dance back to seizures because if you were looking at 3 products, let's go with that would help reduce seizure intensity in your pets. One would be fish oil,
Mhm,
one would be CBD, one would be coconut oil. These medium chain triglycerides are
mhm,
that is the basis, guys, for the Purina seizure diet is just simply medium chain triglycerides, aka coconut oil in their mixed into their diet. And the third component of that triad for natural supplements and around seizures is curcumin. Not turmeric, but
mhm,
curcumin. And all
right,
three of those products have ample science behind them.
right. Yeah, that's a great tip, and the curcumin is good for inflammation. It's good for overall health. We could probably do a whole episode on curcumin alone.
Yeah, and so knowing that you tried to gloss right over that, let me just make one point for people, and that is that I'm very much a curcumin kid because of a health issue that I ran into back in the day. And sorry about that. That is my golden retriever puppy announcing my neighbor's arrival. And so I can speak for hours on curcumin. And the thing that I want your listeners to be absolutely crystal clear upon, if they don't listen to a single other word that I say, please listen now. Turmeric is not curcumin. Turmeric only contains 3 to 4% curcumin by weight.
Hmm.
Everything else in turmeric is not, it's inactive. It is not biologically active. And so when you buy a pound of curcumin, there is, way less than an ounce. There's a quarter ounce or so. I think I misspoke. When you buy a pound of turmeric, there's less than a quarter ounce of actual product in there that is valuable to your health. So if you guys are buying curcumin as a way to help reduce inflammation, as a way to help normalize your GI tract, as a way to reduce anything going on in your noggin, and oh, by the way, as a way to help reduce cancer risk, please buy curcumin as opposed to turmeric.
Hmm. Yeah. Yeah, you're right. We could do a whole episode on just that, but we won't. We won't. We'll get
Okay.
to one final category of
All
supplements,
right. Go.
calcium and bone supplements. Thoughts on those?
Tend to be overrated. There's some concern that if you're on a high calcium, high phosphorus diet, if you're using high calcium, high phosphorus supplements, you're putting your pet at risk, in particular with the phosphorus for kidney issues. And there is pretty good evidence, Brittany, that these supplements also will worsen arthritis for you. The last
Mm,
thing in the world you want when you're starting to develop these little bony arthritic spurs is something that will provide them with more groceries, more calcium and more
right.
phosphorus. And so, again, these are tested for as part of every chemistry panel that your veterinarian will run. And unless your pet has diagnosed deficiencies, I would stay away. This is a categorical recommendation. I would stay away from calcium and phosphorus supplements.
Good advice. All right, Dr. Kevin, we appreciate you coming on again. If anyone wants more information, where can they find you?
Well, I run a little business called helpingpetslivelonger.com. And that's where I use a combination of concierge consults, supplements, some of which we've talked about, some of which we haven't, and prescription longevity drugs like rapamycin and acarbose to help your pets, whether they be dogs or cats, live longer. And the other website that I put together for podcast listeners like your clients here, Brittany, is www.freevetcall.com. Freevetcall.com. And all that is, it's a one pager. You can go there, you can click a link and get 10 or 15 minutes of time on my calendar. It's absolutely free. And you and I can talk about supplements. You and I can talk about vaccines. We can talk about longevity strategies for your pets or whatever you guys choose to. So those are the two ways that I would ask your pet parents to get in touch with me.
Awesome. Well, thank you so much for sharing this. I'm sure there will be an episode 3 with you,
All right.
'cause there's so much more to cover. So thank you, Dr. Kevin.
Okay. Thank you, Brittany. Have a good day.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.